Hi, my name is Holly Klein. This is my quality improvement education project. The topic is preventing workplace violence and bullying. So to start, these are my objectives, and these objectives are for my entire project. Um, I had decided to implement both online training and then in-person teaching. So these would be considered objectives for both sections. So the first one would be to apply. Um, you will be able to apply the new policy rules in nursing practice that will keep bullying or violent behaviors from impacting you. The second one is demonstrate. So you will be able to demonstrate the use of the new charting system to report any incidents that occur. And then the last one is to predict. You will need to be able to predict the amount of time it will take to get feedback on a problem reported in this new system that is implemented. As you can see, I have a picture of Bloom's taxonomy triangle there, and my objectives come from the apply and the understandings portions. So this is the pre-test portion. As you can see, I have 3 questions. Have you been harassed in the workplace? Has anything actually been done about it? How do you and your facility officially report being bullied by a coworker or manager? And have you seen harmful actions towards other coworkers happen but you didn't know what to do? So in my facility that I used to work at, when I would report a problem of any kind, there would be pushback by management, or push to report this. However, once anything was reported, an event, an occurrence, nothing would ever happen about it. You would just send off the report and nothing happened. So the same thing happened over and over and over, and this just was like a big red flag to me. So we need to be able to predict the amount of time that it will take to get a response, and it should take no longer than 14 days to officially get an answer or the start of the problem fixed. So then we also need to be able to demonstrate to you the way to open up the report system and report the incident fully. You can do this anonymously, so if your manager, or if it is your manager, then you don't have to worry about any repercussions because of any reports that you did. So this is our educational plan for this topic. Um, Over on the right hand side, I have a little blurb. It says, under the Occupational Safety and Health Act of 1970, employers are responsible for providing safe and healthful workplaces for their employees. And that's a big one for me because if you go to work, you need to feel safe and like you are protected. So our first educational point is assess the person's knowledge of workplace violence and bullying. And that was covered and will be covered with the pretest. We will see how much you know, and that will help us learn what we need to make sure we teach you more of. So our second point is assess. Assess the person's understanding of the newly implemented and educated policy. So you will have a post test that you will take. So we will see if you understand everything that you were taught through this class, through the in-person training, and through the online video that is strictly over the policy. And that will tell us if you learned what we were hoping you would learn from our information. And so the last one is analyze. We will analyze the understanding of the new policy in each person's through the data collected from the post-test. So all of the answers will be taken and we will gather data from every single person that took this and see maybe what was not understood the most or what needs hit a little more. So throughout the year, we will update our policy and make sure it keeps getting better for everyone. And then every year there will be new education on the policy, and that video will be updated with the policy as time goes on. So here's a little education on my topic. My topic's a little different than the others. This is not something we will learn and implement every day, like education on medications, a change in the way we assess somebody or way we chart an assessment. This is something that will happen slowly through time, and it will continue to change and continue to help our facility and then hopefully all the other healthcare facilities nationwide. So our target population is the nurses and all the facility employees, social workers, doctors, housekeepers, kitchen, radiology, lab techs, everybody. Workplace violence and bullying are a big issue that need to be understood and kept under control at any workplace, including especially healthcare facilities. Healthcare facilities don't have good policies or plans to deal with or follow through with the problem, so the plan is to implement a new charting system with the in-person training and then a new policy that will be educated through online training at this healthcare facility then to spread and go on, because we need good, effective policy. So the biggest thing I've noticed that employers, management, a lot of people just nag at you to make a report on something that they saw happen or that maybe even you tell them happened. However, once you make that report, there's no follow through. And sometimes when something is done, say they email you back, they say, we're going to do this, but that's where it ends. That never happens, and there's no follow-up email. And my main goal is to make sure there is a change to that. According to alicetraining.com, ensure your employees of the confidentiality in which they can report incidents and assure each of them that no retaliation is made against anyone reporting acts of violence. The biggest portion of that is management. People need to feel comfortable making reports that they feel if they are being bullied or harassed or anything against a manager or even higher up. Nothing should be tolerated just because somebody is a step higher than you. So here we are assessing our knowledge. Did you know, according to the Bureau of Labor Statistics census of fatal occupational injuries, of the 5,147 fatal workplace injuries that occurred in the United States in 2017, 458 of those cases of intentional injury by another person. So over 450 of these 5,000 cases were intentional. And that is what we need to change. There should not be this many. So what are some risk factors of workplace violence? According to OSHA, working with people who have a history of violence or who may be delirious or under influence of drugs, poor environment design that may block vision or escape routes, working in neighborhoods with high crime rates, lacking in training and policies for staff, and high worker turnover. Those are all risk factors. Nurses can have workplace violence issues, and it does not have to be verbal. It doesn't have to be physical. It could be either. But that will cause them to miss days. So if you have somebody that is verbally abusing you, that can cause some mental stress, and in turn you don't want to go to work. Nobody wants to deal with that. So then that nurse quits this job and goes to another one. However, that nurse was hired because they were so short, they finally got one person hired. So now there's a nurse shortage yet again. So in the Title VII of the Civil Rights Act of 1964, this prohibits harassment founded on color, national origin, race, religion, and sex. There are many other federal laws that prohibit such behavior, especially based on age, disability, and genetic information. And then there are also state laws. It's different state by state, but that prohibit any type of harassment. And if there is harassment and it is reported, there are legal actions taken. And that is exactly what needs to be done if something happens. We need to make sure that there are consequences. So, and then how many have been affected? I talked about those numbers. 5,174 fatal workplace injuries occurred in the United States in 2017. But also, there have been reports that indicate 21% of registered nurses or nursing students, just students who haven't even started working yet, have said they have been physically assaulted. More than 50% have said they've been verbally abused from workplace violence, and that includes bullying. That is a huge number, and to think that students are getting harassed, bullied, before they even get to a job, that means that some of those nurses will never make it all the way through nursing school. They will quit, they will give up, and they will go to something else because they cannot handle that bullying, and they shouldn't have to. So that is what we want to stop. We want this policy to be implemented and to help keep everybody safe. Now that you have seen everything the new policy will incorporate, you have seen everything that we will do to make sure all of this is known to all facility employees. We have a test. So this test should be fairly easy if everything has been listened and read. So the first one is, can you show step by step how to report a form of bullying? That answer, of course, would be yes if you have been to the in-person training. Yet this is not it. The second question is, what is the correct number of days they have to to respond to any reports? And the answer, which we talked about, I think I said 3 times, it would be 14 days. And then what does the new policy say about who can report any form of bullying or violence? And this was talked about multiple times too. It is any employee in the facility. Management is not an exception. And these are my references. Thank you.